I've been an NHS manager for nearly 40 years. I've been fortunate to have had some great experiences, and I've learned a lot in that time. The last 6 months working on COVID vaccination has shown me how truly astonishing people can be when they're working to a common goal. Our programme started back in December with 3 sites seeing 2,000 people a day. Then GPs started vaccinating, and we went out to care homes and into people's own homes. In February, we set up 17 community clinics, and we now have 18 separate venues. As of last week, we even have a bus. Next week, we'll be vaccinating 14,000 people a day. That is a remarkable scale and pace of delivery. While to some it might look like a relatively simple task of putting a needle in somebody's arm, there is an army of people needed to make sure that that happens. At the heart of this is the work needed to ensure the actual vaccine is stored, transported, and handled correctly. The complexity is truly mind-blowing, and our pharmacy and transport dream team have made sure we have used every drop possible. Our services are being delivered in converted concert halls, tennis courts, bowling greens, town halls, places of worship, and now in tents and car parks. Colleagues from our 6 partner local authorities and a host of third sector organisations, supported by the Army and squads of volunteers, have created all these spaces in record time, even working through the night. They have kept them spick and span and helped anxious citizens to and from their appointments through snow, wind, rain, and even sunshine. Every vaccination given is recorded electronically, and our e-health teams have put Wi-Fi in places you wouldn't have thought possible. They have responded to every scheduling request thrown at them, and there's been a lot of them. I have lost count of the number of times they have worked into the early hours of the morning, and our contact centre has dealt with thousands of calls and queries. The admin team are the public face of our service. They get all kinds of questions and queries thrown at them, and they keep smiling throughout. They will leave us with some great tales of epic Glasgow banter, particularly from our older citizens. All the changes in the programme have meant constant fluctuations in our need for workforce, and the dedicated bank team have risen to every demand we have made of them. We have been supported by staff partners and developed an incredible interdisciplinary team. Last, but by no means least, our clinical staff. They have come from a range of backgrounds: nurses, doctors, dentists, pharmacists, and optometrists, to name but a few. Our MSCO physio team did an incredible job of vaccinating in our acute hospitals and prisons. Support staff have come from clinics, hospitals, and the community to a completely different world. They have had to cope with innumerable changes in policy and practice. They juggle 3 different vaccine types and have responded to every challenge we've thrown at them. Most recently, the introduction of drop-in clinics, where you truly have no idea what to expect when you come to work in the morning. They have dealt with it all with grace and good humour and have never once let us down. It's been my absolute privilege to work on this programme, and I want to thank everybody who has played a part in making this such a success. Thank you.